Hello guys, welcome to my YouTube channel Edge on Pharmacy. Yes, let's discuss in this video which type of questions are asked in GPAT exam. Okay, GPAT students means those who are preparing for the graduate pharmacy aptitude test. For them, which topic you have to cover, okay, what type of questions, so that you can get some of the basic idea. Clear? Every year you are writing the GPAT exam in the month of April. Okay, sometimes there will be ups and downs in the months, but every year the NTA will conduct in the month of April only. Clear? Now this question is very important. Okay, why means we don't know here. Everyone knows GPAT. What is GPAT? They don't know which type of questions are asking. They will just read all the books. They will just read all the questions, all the question banks and all. But that's not a correct way. Okay, these tricks I am going to tell you. You follow these tricks, definitely it will help you a lot. First tricks here, majorly from previous year question paper. This is one of the very important top point. First, what you have to do means you have to collect some of the previous year question papers. Maybe that is a 10-year question paper, 15-year question paper, but you have to collect the question papers. Okay, keep it aside you. These are 10 years or 15 years or 20 years. 15 years is more than enough. You can collect, you can means you are capable to collect for 20 years means good, no problem. Then example based questions are very important. Example based questions, some of the example based questions are there. For an example means this drug is an example for, they will give four options. That is also very important. Example based questions, and they will give some of the examples directly. These are the, among these which of the following is a not antihypertensive drug. See, some of the examples they will give, example A, B, C, D. Okay, they will give some of the in option A they will give some of the drug, in option B, option C, option D. Okay, and they will write there, among the above following four options, which of the following is a not a hypertensive drug or not a hypoglycemic agent or oral contraceptives. This type question, example based question, are very important. So while you are studying the drug in medicinal chemistry or in pharmacology or in pharmacognosy, better you study their examples. Minimum you remember 3 to 4 examples. Okay, minimum 5 to 6 examples, it's more than enough. Very good. Then classification of drug, also very important topic. Why means many students they just know the classification, but drugs classified, for an example, see now in barbiturates, long acting barbiturates, short acting barbiturates. In that short acting barbiturates, some more classifications are there, means some more examples are there. In long acting barbiturates, some examples are there. Sometimes what they will ask, among the following, which of the following is a long acting barbiturates, short acting barbiturates. Not only barbiturates, any topic you take, among the following, which of the following is a ACH inhibitor. Okay, ACH inhibitor, angiotensin converting enzyme inhibitor, which of the following? This type of the questions will be asked repeatedly in your GPAT exam. So classification of the drug also very important. Then synonym names, yes, this is also one of the major novel question asked in from the year 2020. Synonym question means they are having the different names, same answer but different name. For example, cardiotonic. Okay, some of the drugs like digoxin or digitoxin or calcium channel blockers, these all are the cardiotonics. These names you have to understand. Then commonly used drugs with treatments. Now see, some of the drugs they are commonly used in the market nowadays, like some of the hypertensive drug, diabetic medicines, type 1 and type 2. Okay, for which patients you cannot give type 1 medicines, for which patients you cannot give type 2 diabetes. This type of the conclusions you have to understand in the GPAT exam. Then anti-rheumatic drug or anti-arrhythmic drug. Okay, then cancer, very important, cancer treatment, or which of the following is the major tumor. This type questions also asked. In cancer, one question is fixed here. Okay, and in hypertension, in pharmacology or then in pharmacognosy also, then medicinal chemistry also, there are some questions which are fixed. Okay, among 125 questions, 50 questions are fixed in your exam. From this topic only they will ask. Okay, and next is a sixth point, that is novel drug discoveries. Some of the new drugs like levocetirizine or fexofenadine, means some of the new drugs like metoprolol, telmisartan, okay, rosuvastatin, rivoxib, then rifampicin, isoniazid. These are the some of the novel drugs. These novel drugs you have to understand. Okay, which drug introduced in the year 2022? This type of the questions you have to frame. That is also helps a lot in our examination. Then antibiotic. Antibiotic, it is the major section in GPAT. Every year you will get 4 to 5 questions from the antibiotic. Either maybe they are cephalosporin antibiotic or broad spectrum antibiotic, or you can take some of the penicillin type of the antibiotic, any type, but antibiotic is fixed here. Okay, and you read logic questions, just don't by heart. You made your own question there, you make, because in GPAT they will not ask direct questions, logical questions. You think about that. Okay, you think you are treating with the patient, or you are treating with the some of the customer. Okay, so you treat like that way and you study. Definitely you will get interest also in your studies, and you will fulfill your dreams also. That's a GPAT. Then mechanism of action, very important topic, mechanism of action. Here they will don't ask write the mechanism of action of a fexofenadine, write the mechanism of action of histamine, write the mechanism of action of some of the antihypertensive drug, hypoglycemic agents. No, not like that way. Here they will give some of the drug. Okay, among the following, among the following, which mechanism of action correlates with? They will give A, B section. Okay, A section 1, B section 1. Among these, which correlates with each other? This type of the mechanism of action. Okay, and mechanism of action is very important. That tumor necrosis factor, this type, TN alpha, these all are the very important. This point you have to remember. This point you have to remember. This mechanism of action is very important. From mechanism of action you will get 5 to 6 questions every year in pharmacology. Then in some of the structure activity relationship, that also, which carbon atom can get structure activity relationship in medicinal chemistry. See, these questions if you practice means safer side, you are on a safe side. So these are the some of the 8 points which help you in your GPAT exam to in your preparation. So later we will discuss some of the important questions also. Until now, if you are new to this channel, then first you subscribe our channel Enjoy Pharmacy. Thank you.